TB, tuberculosis, right? 2 days back, there was an annual TB report that was launched by Ministry of Health and Family Welfare, right? In this context, we'll try to see what is this tuberculosis, what are some new variants in this tuberculosis, what is this Indian annual report of TB 2020, what are some interesting findings in this report, and there is also another report called Global TB Report of 2019, and what are some challenges in tackling this TB in India. All these dimensions we'll try to analyze. So before we get into this, the data and the statistics which we will be discussing now in these reports is very much useful for us in essays and also in GS answers, right? So keeping this in mind, it's better if we note down these statistics and data with patience, right? So before going into the report directly, we'll try to see what is this TB. So this TB is basically a disease that is caused by a bacterium called Mycobacterium tuberculosis. So this is the bacteria that is responsible, and this is one such disease that mostly affects the lungs. And how is it transmitted? This is usually transmitted from person to person through air, right? Through the medium of air, that is by coughing, sneezing, or spitting. The germs, they get dispersed in the air, and from person to person through this air medium, the transmission of this disease takes place. And what are some symptoms of this TB? As we know, some of the symptoms are chest pain, cough, right? Cough with blood, weight loss, fever. These are some of the symptoms that are associated with TB, right? And does this TB have a treatment? Yes. TB is a curable disease, right? It's a curable disease with antimicrobial drugs, which can be used to cure TB, right? So it is a treatable disease, curable disease. And coming to drug resistance, now we can see this drug resistance is one astonishing term, or mostly we can see this term in the news. Why? Because drug resistance is increasing. More and more bacteria, they are getting resistant to the drugs which are used to kill them. As a result, what is happening? As they are becoming resistant, these drugs are not effectively treating the diseases, right? They are not being able to tackle the bacteria. This is called drug resistance, right? So this is increasing nowadays for various reasons. We'll be discussing about that in another class, but to speak roughly, this drug resistance is increasing because the patients are not using the prescribed medicines till the prescribed date, right? They are not continuing the entire prescription. In between, if they are okay or for various reasons, they are stopping the medical prescription of the doctor. This is one reason. Second reason is overuse of the drugs, right? Without consulting the doctor, simply going to the pharmacies and taking some drugs to cure your disease. Because of this also, overexploitation of drugs also, the bacteria are getting resistant to the drugs. This is a huge serious issue, right? So in this context, if we see the tuberculosis disease, some drug resistance is observed in the tuberculosis disease also, right? Firstly, MDR TB. So a new kind of TB disease has come. This is MDR TB, multi-drug resistant TB. So what is this? Basically, the drugs which are used to cure TB among the TB patients that are not working, for some bacteria, right? So this is multi-drug resistant TB, right? And the drugs which are used to this TB people can be classified into two types: first line drugs and second line drugs. First line drugs, as the name suggests, these are the basic drugs that are given to the TB patients, right? So in the multi-drug resistant TB, the bacteria are getting resistant to the first line drugs. So second line drugs are being used to treat these patients. Second line drugs are nothing but next level drugs, next level to the first line drugs. So they are able to solve the problem of TB up to some extent, right? But there is an other new variant in TB which is called XDR TB, right? XDR TB, extensively drug resistance TB. This is. Now, how is this different from MDR TB? In this XDR TB, even the second line drugs are not able to kill the bacteria, right? The bacteria have developed resistance even to the second line drugs also. So as of now, if we see, there is no treatment available for this XDR TB patients. So this is another variant in TB. So MDR TB and XDR TB, these are related to drug resistance in tuberculosis. One is multi and other one is extensive drug resistance. So this is broadly about TB, right? Some information which we have to know with respect to TB. Now coming to the significance, we can directly expect a question on TB in mains or in essays when we are talking about healthcare or when we are talking about some diseases which are very much seriously affecting many patients or many people in India. TB is one example which we can definitely cite, right? We'll try to know this in the future, like why I'm stressing that much on TB, because this we can use even in essays and in GS answers also. Anytime we talk about healthcare, this we can use because India has so many TB cases. We'll go into the statistics now. So starting with the annual TB report launched by our Ministry of Health and Family Welfare. Now this report tries to evaluate the situation of TB in India, right? In this way, many reports are released by our government ministries, which you can find in Press Information Bureau. This is a portal of the government itself. It's like government media. It is PIB, Press Information Bureau. In this PIB, you can get all the important reports that are released by ministries, because these are very much important for us with respect to UPSC, because straight away we can cite these reports as data in our answers, right? Rather than saying agriculture, 66% of agricultural lands are dependent on rainfall. If we bring some report, the recent report given by Agriculture Ministry or Niti Aayog, and then say this statement, it definitely adds value to our answer, right? So we'll now go into this annual report of TB 2020, right? Indian report. So this, some key points in this report are, first thing is, this has tried to evaluate states based on their performance with respect to TB, right? And then it came to some rankings and it said that Gujarat, Andhra Pradesh and Himachal Pradesh, Gujarat, Andhra Pradesh and Himachal Pradesh, these are the three states that were top 3 best performing states. Among all the states whose population is greater than 50 lakhs, Gujarat, AP and Himachal Pradesh, these are the 3 states that were the best performing states. Now among those states whose population is less than 50 lakhs, Tripura and Nagaland were the best performing states, right? And coming to union territories, Dadar and Nagar Haveli and Daman and Diu, these are the 2 union territories that were best performing with respect to TB performance, right? So these are some statistics which we have to know with respect to prelims, right? Because straight away there can be a question saying, in the recently launched annual TB report 2020 by Health and Family Welfare Ministry, and 4 options can be given. AP is the best performing, or Telangana is the best performing, or Karnataka is the best performing. So we have to know this idea, like Gujarat, AP and HP are the top 3, and Tripura and Nagaland among the smaller states. Dadar and Nagar Haveli and Daman and Diu among the UTs, union territories, right? And then this brings out 3 important relations, like how other diseases are related to TB, right? 3 important findings. First one is TB related to tobacco consumption. This is first finding. Now this report says that there is a rise in tobacco linked TB disease, TB deaths, right? Tobacco linked TB. That means because of increase in consumption of tobacco, people are getting TB, right? This is one finding which the report brings. It says 8% of the TB cases are due to tobacco usage. So tobacco is also related to TB. This is one finding. Other finding is HIV patients and TB, right? It says that HIV people are the most vulnerable to tuberculosis because HIV is one such disease which seriously compromises immunity of an individual, right? Immunity of an individual is compromised. That means he is more vulnerable to any disease, and especially to diseases like tuberculosis, which can spread through air from person to person through air droplets. HIV people are more vulnerable. This finding is also told by the report, and it tells some statistics that 9% of all the HIV linked TB deaths, 9% of all the HIV linked TB deaths in the world belong to India, right? So if we take the entire world, those who are dying out of TB, who are having already HIV, among this 9% are in India, right? So this is one statistics. The second thing is annually 92,000 HIV linked TB patients are found in India, right? 92,000 HIV linked TB patients are found in India. So this is another statistic. So HIV and TB are closely related. That means someone who is having HIV will be more vulnerable to catching TB also, right? So this is second finding brought by the report. Third finding is diabetes and TB, right? Diabetes and TB. It says that 20% in India are having both TB and diabetes, right? 20% in India, and that means among all those who are having diabetes, 20% of them are also having TB, right? So TB and diabetes are also related, and it says in 2019, among the TB patients, 64% are screened for diabetes by the government, right? Among all the TB patients, government screened 64% for diabetes. So government is taking such a step implies there is close relation between diabetes and TB also, right? So these are some interesting findings which this report tries to bring out. Coming to the success rate in the treatment, in the past 2 years, the success rate was 70 to 73%, right? 70 to 73% was the success rate in treatment. Previously, it was 76 to 77%, right? Previously, it was 76 to 77%. Now it is 70 to 73%. This is also an observation brought by our Indian report. And other dimension which this report talks about is lower reporting than WHO. WHO is World Health Organization. It also gives annual data about TB in the entire world. Now, as a part of that, WHO has told that there are 26.9 lakh TB cases in India. But through this report, India is saying that we have only 24.04 lakh cases, saying that cases there is under-reporting, or WHO is over-reporting the cases. What Indian government says is actual numbers are less than what the WHO is finding out or estimating, right? So this is one thing. And second thing is WHO says there are 4.4 lakh deaths of TB in India. But through this report, through this annual TB report, our government says that there are only 79,144 deaths in India. So where is 4.4 lakh and where is 79,144? So this shows that, so what the government is trying to say through this is that compared to WHO, reporting is low in India, right? So these are some interesting findings from the TB report. So if we see some challenges, there is another report that is given globally, that is Global TB Report 2019. Who gives this? WHO gives this. Now, any report which is in the news, we have to be thorough with who is publishing it. Annual TB report of India is being published by Ministry of Health and Family Welfare. And Global TB Report 2019 is being published by World Health Organization, WHO. Every year it is being published. Right? Now, what is the issue which WHO brings in this report is there is large gap in reported cases versus number of actual patients with TB in India. That means if there are 100 people suffering from TB in India, India is reporting only 20 or 30. This is one challenge which WHO report brings out. It says that there is large gap in the reported cases versus number of patients who are actually suffering from TB, right? And the reason which it cites is underdiagnosis. Underdiagnosis. That means diagnostics means checking an individual whether he has a disease or not. The present scenario we are seeing testing for corona. That is the diagnostics. That means they'll try to test whether an individual has a particular disease or not. That testing, that diagnosis is not proper in India. That's what this WHO report says. That is why India reports less number of cases. That is one argument which the World Health Organization is saying. It's saying there is large gap in the reported cases versus number of patients suffering actually with TB. That is because underdiagnosis, right? And 1/4 of this gap is in India itself. That also it says, right? 1/4 of the gap. That means in the entire world, if there is a gap between actual number of people and reported cases, for example, the gap is say 1,000 people, like 1,000 people are left out without being reported, but they have TB. Among this 1,000, 250 are there in India. That's what this WHO says. That means underreporting is very much in India. It's increasing in India. That's what this WHO report says. And also it says that India is among the top 8 highest TB burden countries, right? India is among the top 8 highest TB burden countries. That means among the top countries which have highest number of TB cases, India is among the top 8. And globally, if we see, out of all the cases in the world, 27% of the cases are in India related to TB, right? This is another interesting fact, or rather shocking fact, which World Health Organization points out in its report. And the third interesting finding is MDR TB. If we see MDR, the multi-drug resistant TB which we have discussed, even in this MDR TB cases, India is among the top 3 countries with the largest share, right? In this MDR TB cases, around 27% cases of MDR TB are also in India, right? 27% of the global cases related to MDR TB are in India. Now here we can see India tuberculosis is very much rampant, right? The numbers who are suffering because of tuberculosis is higher in India. That's why we can cite this TB, or rather we should cite this TB as one of the health challenge whenever we are writing in any essay or in our GS answers, right? These are some interesting statistics which we have to remember, right? So overall, if we see the annual report which we spoke about, which was launched by Ministry of Health and Family Welfare, that also speaks about some government initiatives in the field of tuberculosis, right? Some government initiatives to reduce this tuberculosis in India. First is Nikshay ecosystem. Nikshay, Nikshay, Nikshay ecosystem. What is this Nikshay ecosystem? Basically, the government has planned to create a single portal where we can get the entire information about a TB patient. Entire information about a TB patient, and even able to monitor the progress of treatment to a TB patient, right? So entire information, health information, and how is the progress of diagnostics and how is the progress of treatment for a TB patient. All this information, the government is trying to create an IT portal for this. That portal's name is Nikshay portal, right? So that is Nikshay ecosystem, bringing the entire TB related information into a portal, into an IT platform, right? This is a one-stop portal for TB. One-stop portal means entire information you can get it here. That is the first thing. Second thing is Nikshay Poshan Yojana. There is a scheme that is being implemented for the TB patients. That's name is Nikshay Poshan Yojana. Now, what is this Nikshay Poshan Yojana? So this is basically a financial support to the TB patients for nutritional needs, right? This is a financial support to the TB patients for meeting their nutritional needs, because nutrition, healthy and enough nutrition is also required for an individual, especially when he is suffering from a disease like TB, right? So maybe not everyone have the money or can afford to have good nutrition. So for helping those people, government has brought this Nikshay Poshan Yojana, right? This is the second initiative. Third initiative is government also started a campaign called TB Harega Desh Jeetega campaign, right? This is a campaign that's being run by the government. Its name is TB Harega Desh Jeetega campaign. This is basically to increase awareness among the people, right? To increase awareness among the people about TB. This is a campaign that is being run. The fourth one is by an institute called Tata Institute of Social Sciences. TIS, Tata Institute of Social Sciences. So this institute is running a project called Saksham. SAKSHAM, Saksham. So this is a project that's being run by TISS, Tata Institute of Social Sciences, for providing counseling to the TB patients, right? Socio-psychological counseling to the TB patients. That's also very much important, because treatment is equally important. Along with that, this counseling is also important for making an individual mentally strong, right? For that, TISS is running this Saksham project. And also, government has kept an ambitious target of eliminating tuberculosis from India by 2025. The entire global community or the world has taken a pledge under Sustainable Development Goals to eliminate TB by 2030. But our government of India has taken an ambitious target to eliminate TB by 2025. Even 5 years before the world is achieving, India wants to achieve this feat, right? So this is also one ambitious target that is kept by government, eliminating TB by 2025. And for this, the government has come up with National TB Elimination Program, right? National TB Elimination Program. So these are some of the initiatives taken by the government. Now, we have discussed about challenges also. So then what should be the way forward? There are some areas where the government has to focus more. First thing is timely and accurate diagnostics is important, right? First of all, identifying who has TB is very much important. That is the first area where the government has to improve, right? Where more efforts are required. Only when we test and identify who has TB, only then we can do the necessary treatment and reduce the TB cases in India, right? So timely and accurate diagnostics is important. And secondly, inclusive treatment is required. One of the challenge in India is TB patients discontinuing their prescription in between because they cannot afford the treatment, right? So affordability and accessibility to TB treatment has to be increased. So inclusive treatment has to be there. Thirdly, private sector also have to play a role with respect to eliminating tuberculosis, right? Even in the present scenario, if you see, even in the corona cases, we are seeing many arguments saying that private people have to extend their helping hand in defeating the corona in our country, right? In terms of labs or in terms of providing medical treatments, even private people also have to play their role, right? That argument holds true even for a disease like tuberculosis also. So this is the third thing. Private sector role has to be improved. Fourth thing is social stigma that is associated with tuberculosis also has to be removed. World Health Organization in its report cites social stigma as one important reason why people are not coming to the hospitals for treatment, right? So social stigma, what is this social stigma? Social stigma means basically the feeling in an individual that TB is some non-curable disease. If you get TB, then you have to die. That is one kind of feeling. So people will start alienating you. They'll start seeing you as a different entity or a different individual and discriminating you. That is called social stigma. So this social stigma also has to be removed in the society about TB, right? So campaigns have to be increased. Awareness programs have to be increased. That is one thing which we have to do. And even in research and development, we have to intensify our efforts. We have to increase our efforts in research and development. Only then we can come up with affordable treatments, right? Even in the case of corona also we can see, firstly for testing corona, they have said it is around 4,800 rupees or 5,000. Now with research and development, with good efforts in R&D, we have brought that to some 2,000 or 1,500. And also we have come up with different methods of tests, not one single way of testing, but 2 to 3 ways of testing. Now this was possible because of research and development, right? So even in the case of tuberculosis also, research and development we have to focus. And with respect to tuberculosis, another important bit we have to know with respect to prelims is World Health Organization also has kept a strategy called End TB strategy. Now this was set up by World Health Organization. This we have to know with respect to prelims, because straight away they can ask End TB strategy. This was taken up by which organization? World Health Organization or Lancet organization, like that. 2 to 3 options can be given. So WHO has taken this End TB strategy. This strategy is basically about eliminating TB in a phased manner. In a phased manner. This strategy keeps targets. By 2020, 90%. By 2025, 95% have to be eliminated. By 2030, completely this TB has to be eliminated from the world. In this way, phased targets are kept by World Health Organization in this End TB strategy, right? Overall, if we have to conclude this TB topic, definitely we can connect this elimination of TB to Sustainable Development Goal 3. What does this Sustainable Development Goal 3 say? Health for all. Health for all, universal health coverage. Under this Sustainable Development Goal 3, which is 3.8, the global community has decided to eliminate TB by 2030, right? So this is also a part of Sustainable Development Goal 3, right? So if we are able to eliminate TB by 2030, that is definitely a good step towards achieving health for all under Sustainable Development Goal 3.